Thank you for joining us for the Southwest Riverside County Healthcare Update with Southwest Healthcare System and Loma University. I'm Patrick Ellis. I'm glad that you could join us today. So I'm thankful to have with me today is Jared Giles, with CEO for Southwest Healthcare System, and Peter Baker, Senior VP and Administrator with Loma University Medical Center, Murrieta. So our purpose today is to help communicate with the residents and businesses in Southwest Riverside County. What are the true impacts that COVID-19 are having on our healthcare system here in our valley? We hear a lot about what's going on in Riverside County, in Southern California, in LA. But I think that it is very important that we kind of get down a little bit more of a granular level and let people know what is truly going on here in Southwest Riverside County, because we are kind of like this little island here surrounded by different parts, but I think we all want to know what's going on right here. So I'll start with Jared. Why don't you kind of give me a little bit of an update, kind of what's going on, with Rancho Springs and Inland Valley, and then maybe Peter, you can follow up with kind of your take from Loma Linda side.
Sure. Thank you, Patrick. I appreciate the opportunity to be able to kind of hopefully get some of this information out to clarify, hopefully put some people at ease, reduce some anxiety of, at least talking about specifically what we're experiencing here at the hospitals. So every morning I come in, I pull up the dashboard. We have a database of everything that's going on, and I can see exactly what transpired the previous day, how many people I have that are COVID positive, how many people we tested, how many are inpatients, where they're located, whether they're on vents. So I came in this morning and pulled it up, and as of yesterday, so these are yesterday's numbers, 11% of my 240 beds were COVID patients. Of those 11%, about a third of those people are in the ICU, and about a third of those are on ventilation. So when I look at what is the capacity for the hospital to provide care, it's how many beds do I have? And then how many ICU beds do I have? And then ventilations, because those are finite resources that we have. And that's kind of how I judge. We are actually on a downward trend from probably mid-July, where we hit a high watermark. And so we've been down. The hospital still is fairly full. What I'm seeing is, as we reduce the elective surgeries way back from March and into April and getting into May, we are trying to get those individuals through, whether it's for hips or shoulders, knees, whatever, bariatric patients, whatever was the elective procedures that got put on hold. We've been trying to get those people through the system. So that, coupled with an increase with COVID, which we don't typically have in a normal year, is keeping us fairly full.
Very good. And Peter, what are you seeing with Loma Linda?
Yeah, thank you. Yeah, I think I want to echo Jared's comments on this. I know there's a lot of work going on, and it's in the news, but we're kind of seeing very similar kind of activity as Jared is. I'd say, our volume as far as the number of COVID patients to our occupancy is usually in the teens. So the vast majority of our patients are non-COVID patients. But what we are doing is similar as many of the other facilities, is trying to do our best. We cohort those patients so that non-COVID patients are being treated in different areas than our COVID patients, to reduce any risk on patients and our staff. But I would also echo some of the comments Jared was making, which is our concern during April and May was people weren't getting treated timely. And what we're starting to witness is, unfortunately, patients who haven't gotten treated timely are now showing up way more acute. Cancer patients with higher levels of cancer are showing up. Patients with heart disease, with higher levels of heart disease, that are having to stay longer because, unfortunately, there was some level of fear of going to a hospital, and that's now playing out. So that's kind of, I think, what we're seeing as well in our hospital.
And that's a great point, because I think that there is some misinformation out there and maybe some kind of fear factor with some people. And maybe you guys can both address this for your facilities. But as far as, people who are coming to, whether it's Loma Linda or Rancho Springs or Inland Valley, they're worried, or there's this fear that they're going to walk in and be amid all these COVID patients or potential COVID patients. And I think that's where, you're seeing that fear to go and get addressed for certain issues. Can you maybe kind of talk a little bit more about what your protocols are to kind of ease, I think, the tensions of some people about taking a step into your facilities? Because I think that there is a lot of misinformation about that out there right now.
Go ahead, Peter.
Well, let me, one thing I do want to comment on is, I've appreciated working with Jared and Southwest. One of the things we do and we set up early on is really a collaboration of best practice. So one of the blessings we have serving in this community is we're all kind of learning and taking ideas from each other to hopefully put in, practices that are the best. And so I think that's one of the nice things is a very collaborative relationships that hopefully learnings at Southwest are used at Loma Linda, and learnings at Loma Linda are used at Southwest. But what we're specifically doing is we have areas of our hospital that we cohort, and like we shared, not only do we have an area of our inpatient area where we keep COVID patients, but there's also an area of our emergency department as well, where we keep patients. We have staff dedicated for taking care of COVID, so we're not putting patients at risk there either. And so we try to cohort the best, put specific patients with communicable diseases in one area and others in others to separate them as best we can. And that's actually worked very well and has been a good practice and has been successful.
And much the same way at Southwest. As far as entrance into the emergency department, they're sequestered into their own area through a separate track for the care, as well as into the inpatient units at both hospitals.
Very good. So obviously, hopefully people understand that, that should not be anything that prevents anyone from going and getting the services that they need.
Correct. And just let me clarify. I mean, like you said, people have this misconception of just right in the waiting room, as soon as they get in, they're going to be stuck with a bunch of people that are coughing on them. That is not the case whatsoever. I still get phone calls from people that know I work at the hospital that say, hey, is it okay for me to come in today? Absolutely. Do not delay the care to come in. Show up with a mask. If you don't have a mask, we will provide one for you. Everybody is screened, from the employees to the visitors to the patients that come in and the physicians. So we are negatively screening everybody, at least on a verbal basis, and temperature checking everybody that comes into the facility.
Great. I want to touch very quickly on testing, only because this is always, one of those big talking points that everyone's kind of, wanting to know more about or is questioning or what have you. So just so everyone understands is that they don't go to the hospital to get tested, right? The idea is the county and the state have certain testing centers set up all across Riverside County. We have 2 or 3 of them set up at any given point here in Southwest Riverside County. Current guidelines are, if you are showing symptoms, then you can get a test, and that's what they want done right now. But just so everyone understands, they do not go to the hospital to get tested, correct?
I would say somewhat correct, yes. Come to the hospital if you have symptoms and need those to be treated in a medical fashion.
Okay, good clarification.
What you're saying, so let me clarify. If you're asymptomatic and you want to be tested, don't come to the hospital.
Right.
If you're symptomatic, but it's a cold or it's not anything that you want the hospital to care for you, purely for a test, probably don't come. And that's what the county and the state testing facilities are for.
I'd echo Jared's comments on that.
Okay, good. Okay, so just wanted to clarify that, because I know there's a lot of questions about that. And we'll put, at the end of this video, we'll put information about how people can find out about where the testing sites are, how to get a test, all of those different types of things.
Perfect.
So we already talked about how people are kind of addressed when they come in and have COVID in your facilities, and that should not be afraid, prevent people from coming to the hospitals. So what should the public know regarding elective surgeries or common appointments that typically would take place at your facilities? What should they know about those right now with all of the facilities? So Jared, I'll start with you.
Sure. So like I said, we did had discontinued elective surgeries up until we started about the first part of May. So we've been working through that backlog of people, because like I said, even though it's an elective procedure, I use that sparingly because people get medical procedures not for fun or whatever. There's obviously some medical condition that they're trying to fix. So eventually it might not become an elective procedure. You really need to get to it. So as we've had what Peter talked about, people that had delayed care are coming in and needing beds, as well as the elective people that we postponed are coming in and needing beds, and the COVID people and just the normal run-of-the-mill, that injuries, accidents that need beds. So we're constantly, once we hit a certain percentage as far as capacity, we're looking at the daily schedule for surgeries and saying, who needs a bed? How many beds are available? I will acknowledge that we have had to kind of move around a little bit on a few selective days. I feel for those patients that we've had to postpone and kind of move them into the next week. That's not to say that we won't do that moving forward. We're really just reacting almost on a day-to-day, a weekly basis, looking at what's on the schedule. As physicians take vacations or whatnot, it goes up and down. So I don't have any anticipation that we would stop elective procedures moving forward, but you never know. We've watched it across the country. Some of those locations that have hotspots, they've been either ordered by some governmental agency or their professional organization say, hey, you need to stop elective procedures because they were so concerned about the available resources for those hotspots. Thankfully, we're not in that same condition right now.
Yeah, I would echo, Jared's comments on this. I think what we're all trying to do is, if we don't take care of patients now, then they'll likely show up later in oftentimes worse situations. So we've actually really want to do our best to get elective cases in. But there are times, where we see spikes and it becomes challenging to manage all of it, that occasionally we have to shuffle patients around or ask patients to maybe come the following week. But that's few and far between. We very much are doing our best to treat as many patients as possible and as safely as possible. One other thing I might comment on is, as far as the process for coming in for an elective procedure, both Southwest and Loma Linda require a pre-admission testing for you to get tested for COVID. And so that will be expected a couple days before your care.
Yeah, and that's good to know, because I think that there was, some confusion out there from what we've seen and heard, is that there wasn't, when kind of things started to close up again, was, elective surgeries are back off the table right now, but that's not the case. And it's good for people to understand that there's those opportunities are still there, even though you're having to be very flexible with them, as people have to be as well too. So what would be, and I'll start with you, Peter, what would be your visitation policies right now? Because I know that's a big question a lot of times, is, who can visit, what are their guidelines, those types of things.
Yeah. This is really a challenging thing, for our institution, as, all of us hospitals strongly believe in the importance of family and friends play in the healing process. However, we're having to limit our visitors, not because we want to, but it's essential so we're not spreading, the disease to others, and we're protecting our staff. We really very much want and love having visitors. Unfortunately, the guidelines just are requesting that we limit it, and accordingly, we have very, very, very limited visiting hours. I'd ask, and as time goes on, we try to ease those up. But currently, I think we're allowing a visitor in some of the L&D one visitor and NICU. And we also allow, in very challenging circumstances, visitors in the adult area. But we have video capabilities and other things. But in order to protect both the family and the staff, we're having to significantly limit it more than we'd hoped for. And we just pray for the understanding of the community as we go through this.
In similar fashion, the most up-to-date policies are on our website. So if you have a friend or a loved one here in the hospital, feel free to check that out. We do have very limited visitation right now. Typically it's one individual, and that's the only individual that'll come and see that patient for that day for a limited amount of hours. And it is, like Peter said, it's to reduce exposure of our own staff and reduce exposures of everybody else that's in the facility.
Yeah, makes perfect sense. Okay, so a question that we get a lot is, how are your facilities doing regarding PPE? I know that, we have a lot of phenomenal partners in our valley. And obviously, based on what you guys have been talking about, is you guys work very closely together on a lot of different levels. There's a lot of individuals and nonprofits that have been very proactive in providing PPE to different companies and individuals. And I know too, you guys have always reached out to find out. But how are things going with you guys regarding PPE right now? Jared.
Sure. First, let me say, as you noted, I'm so thankful and appreciative to the communities and the organizations that stepped up and donated items to us in our time of need. I think from the get-go, that was one of my biggest anxiety things, that we wouldn't be able to provide our staff with the PPE appropriate for them to care for patients. Thankfully, over time, we've been able to increase our PAR levels and really have, policies in place about what PPE is used and where and in what situations. So I feel very comfortable that we have what we need to care for the people, and we're actually trying to beef it up a little bit in anticipation of what might come in the fall for the normal flu season, I'll say. That's kind of the bogeyman that's hanging out there. We're not sure what's going to happen. So we're doing everything we can to prepare for that. But right now, I cross my fingers, but feel very comfortable that we have what we need.
Yeah, I'd echo Jared's comments. We early on, it was obviously top of mind and top of focus. We've been blessed as well to have more than enough PPE to manage, and we monitored every day our inventory of it, and thankfully have more than enough to manage. But also just want to echo Jared's comments and Patrick, your comments on the overwhelming community support. Our community really stepped up in a time of need, and couldn't thank them enough for all that they've done. We've got just a great community really came together during this.
Yeah, that's very, very true. Let me ask a really quick follow-up question, because you mentioned something, Jared, that brought this to my mind. And I say this because, and this may be more of a question with an outline of hope to it.
I feel like I'm getting set up here.
Yeah. So as you mentioned, we're getting closer and closer to the flu season. So is there a hope that, because there's so much emphasis now on washing your hands, wiping down your grocery cart before you go grocery shopping, doing a lot of, wearing a mask, doing these different things now, is there a hope that our flu season may be less than it normally would be because of these precautions that we've been told since we were kids? If you want to avoid the flu, here are the things you do: wash your hands on a regular basis.
Right.
And now that we're doing them because of this, is there a hope that the flu season might not be as impactful because of that?
I think there's a hope. I mean, I'm just a hospital administrator. I'm not a professional, but you see all those practices and the higher anxiety and the attention to that. You would hope that would kind of curb a little bit of the spread of the normal flu. Who knows what the strain's going to be, or the vaccines, or anything, and how that's going to intertwine with what we're seeing with COVID. But I like to believe that there's some hope that things will get better as people do those practices more often.
Yeah. Peter, anything on that?
No, you're 100% right. I mean, the same practices that reduce COVID are the same ones that reduce influenza. So, I'm hopeful as well.
And that, again, that's just me hoping. I know a lot of us, we're all, I was the one where, prior to COVID, my wife would always wipe down the grocery cart before going shopping. And I was the guy, just took it and went and didn't care. I will never go grocery shopping without wiping down a cart ever in my life.
Exactly.
So, I'm hoping that does help us all. So are there any other things that kind of we as the public, we as residents, we as businesses that can do to help, whether it's you guys individually, facility wise, community wise? What are there any last thoughts as far as what are some of those things to just keep in mind that we can do to help, like I said, you guys or just everyone in general? Peter.
Yeah, I mean, I think I just continue to say, thanking, our nurses and our clinicians. I mean, our physicians, they're the real heroes. Every day they come in, have to deal with, many of these patients and frankly, the outpouring of support that our community has. Many of our businesses donated food, have donated, face masks, just that really goes a long ways, and just couldn't be more grateful for the work of our physicians and our clinicians, our nurses and our respiratory therapists. I think a big thank you is probably the best we can do, and gratitude.
Absolutely. I'll echo those comments because it goes all the way down to the environmental service person that's cleaning those rooms all across the board. They realize that they're kind of the backbone of what's going on. So if you have a neighbor that works in healthcare or a friend or family, give them a high five or at least an elbow bump. And thank them.
Yeah, and I think that's a good point. I think, we have a tendency to overlook, the small details, but it's those who are doing the work of going in and cleaning the rooms or changing the beds or whatever, those types of services that kind of get overlooked a lot, but are as critical, if not more so, than every other aspect of what's going on. So
absolutely,
we should thank those as well. Well, I want to thank you guys again for your time. It's really important, I think, for us to get out what the important information is and what's critical right now, what's going on in our valley. I'll ask if there's any last thoughts that you want to share. I know that our intention is to maybe to try to do this again in a few weeks or so, kind of see where things are at, see how things have changed or so, and what we should be updating our public with. But any last thoughts from you guys?
Again, I appreciate you having the forum for us to at least share this information. And I know it's come up before on some of these things about social media and the mainstream media and what's real. I'd go to the county websites. I see all that stuff. I don't want to disparage Temecula Talk or Murrieta Talk or any of the city talk pages, but those kind of get crazy as far as the comments, and just try to, maintain where that source of information is coming from. And I think that'll help everybody out as far as anxiety and really controlling what the facts are.
Great. Any last thoughts, Peter?
No, I'd agree with Jared. I think that the county provides great information, and I think relying on the latest of that will help everybody. Make sure our hospitals are here to serve in challenging times. We're not overwhelmed, and we're able to take care of these the patients as they come for our community. So
great. Well, I want to thank you guys again. At the end of this video, again, we'll have the links. We'll have for the county information, for the latest numbers, as well as for any of the testing information as well. Peter, Jared, I really want to thank you guys again for your time. I know it's limited, in days like these, but we appreciate it, and hope that you guys and everyone else in your facilities keep safe, and we appreciate everything you're doing.
Thank you.
All right, thanks, guys.
thank you.
All right.